Hi, I'm Susan Taylor with Scripps Health in San Diego, California. Hundreds of millions of people visit their primary care doctor every year. It's one of the most important relationships of your life. And that strong doctor-patient relationship relies on open, honest, two-way communication. So how do you pick a good primary doctor who specializes in your needs? Joining us today is Dr. Vivian Tran. She is an internal medicine doctor with Scripps Clinic in San Diego. Thanks so much for being with us.
Thanks for having me.
So let's talk first. What is the primary care doctor?
A primary care doctor is essentially a general practitioner. We're the first line of defense. We're the people that you see when you fall ill in a non-acute, non-emergent setting, and we also provide preventative medicine. We do your annual physicals, we do routine visits.
And there are different types of primary care doctors. Why don't you go through the different types?
Sure. So I practice internal medicine. My specialty is on adults, 18 and over. There are my pediatrician colleagues who focus on kids under the age of 18. There's also primary care family medicine doctors who actually take care of both kids and adults. On the opposite side, there's also geriatricians who take care of patients ages 60 and older, and OBGYNs who take care of women's health and help women through their pregnancies.
So would you see an OBGYN doctor and then also see a primary care doctor, or would your OBGYN be your primary care doctor for a woman?
So usually you would see your OBGYN and your primary care doctor. In certain circumstances, you can just see your primary care doctor and they can do your women's health as well, but some women prefer to have a separate OBGYN, and that's totally fine too.
So what should you be looking for in a primary care doctor?
Sure. So when you're looking for your primary care doctor, the most important thing is to find out, are you looking for an internist who can help manage your chronic medical conditions, or are you looking for a family doctor who can take care of both you and your kids? Once you have discovered that, then you can move on to different types of doctor philosophies and going through the steps of choosing your doctor.
And talk about that relationship between the patient and the primary care doctor. You know, why is it so important to have that really good, strong relationship?
Yeah, so your doctor is the one who knows your medical history the best, essentially, and it's important to have a very strong relationship with them to facilitate your health care. They're the one who will know your medical history best, next to you, of course, and in order to have basically strong health and lasting health, it's going to be important to see your doctor and keep that relationship with them and maintain it over the years.
So, but why is it important to have the primary care doctor? So let's say, for example, why wouldn't I, if I've got a backache or my hips bother me, just go see an orthopedic specialist? Or if I've got problems with high blood pressure, I just go see a cardiologist. What is the specific role of that primary care physician?
Yeah, so we recommend that everybody have a primary care doctor. We like to consider ourselves as the quarterback of medicine and the quarterback of your health, essentially. And our role is really to not only do routine visits and make sure you're up to date with all your screenings, but also if you need to see a specialist, we're the ones that you come back to after you've seen the specialist. We're the ones who take a look at the whole picture and really try to see what's going on and help you coordinate your care.
I like the quarterback image. That's a good one. Yeah, and it's the continuity of care, isn't it?
Definitely.
And that's important.
Mm-hmm. To have the same doctor over a long period of time who is able to see you and understand your history, because they'll know better what's going on rather than just seeing piecemeal parts.
Right, because piecemeal is not as effective as seeing the the whole picture.
Yeah, definitely.
So what questions should you be asking yourself when you choose a primary care doctor?
The first thing that I usually like to tell people is location is the most important. Whether you just moved to San Diego or you are living in downtown North County, it's important to find a doctor that's close to you, whether it's close to your home, close to your work, someone who you have essentially easy access to. You don't want to drive 45 minutes to have to see your primary care doctor.
Not with the traffic the way it is in San Diego.
And another thing is some patients have a preference on female or male providers. Some patients have no preference, and that's totally fine. Doctor schedule is also important, so you want to know, does your doctor work 5 days a week? Are they 7 to 5, or do they do late hours, which Scripps is offering now, extended hours. We have office hours pretty much from 7 to 7, and different providers take different slots of those times. So it's something to look into. If you work from 8 to 5, you want to be able to see a provider who is going to see you from 5 to 7 when you are off work.
This is a very diverse community. What about language and cultural considerations?
That's really important too, because we have translators available, but if you don't speak English as your primary language or at all, it's important to have a doctor who can speak your language if possible, and that makes it just makes a stronger relationship in general. And to have a patient be able to communicate their concerns to their doctor without the need of a translator makes it a much stronger relationship.
And what about age?
Age, so it really depends. Some patients have no preference. Other patients, they don't really want to deal with the age gap. The age, I guess, the cultural barriers and the generational barriers, so to speak.
For some folks, that's important.
Some folks, that's important.
Sure.
Some folks, it doesn't matter. So just find if that's important to you, and you can look for your doctor in that way too.
So in just a couple of minutes, we're going to have advice for new patients when they're establishing care with a primary care doctor, what you should bring to that first office visit in terms of what your medical history is. So hold that thought. We'll come back to that in just a couple of minutes. When you talk about all of these, questions that you should ask yourself when choosing a primary care doctor, how do you suggest that folks do their homework? Who to choose, who should they go ask, what research should they do?
Sure. So generally I say to begin with, you can always ask your friends and family. Do they have people who they trust, who they've been seeing for years now, and would they recommend them to you? You can also check with your insurance. Sometimes they have already assigned you to a primary care provider, which is something to think about, because if you go see a different doctor who you like, who's not technically your assigned primary care provider, you can stay with that doctor. You just have to call your insurance and tell them that you would like to switch to them.
And then what kind of research should you do to see what your doctor specializes in? For example, a geriatrician, somebody who has a particular interest in one field.
Yeah, so our Scripps website, scripps.org, does have the option to find a doctor. When you click on that link, you can decide whether you want to see a pediatrician or an internal medicine doctor, etc. And when you click on the specific specialty that you want to see, you can then narrow it down by location, and you can read the physician bios. Some physicians have certain interests. It's not a specialty per se, but it is more of an interest in a certain field. Say a primary care doctor has an interest in cardiology. That doctor might be of more benefit to a patient who is looking for a primary care doctor and they have extensive cardiac history, like a lot of heart problems. Yeah. So something to think about.
And what about the doctor's philosophy and the culture? Elaborate a little bit more on that, because I know that some doctors are big on research, or maybe a doctor who's more holistic, that you would combine Eastern and Western medicine. What are those factors?
Yeah, so every doctor has their own philosophy of care, and it's usually listed in their bio on our Scripps webpage, and it might not be, and so it might take an actual face-to-face visit to really understand a doctor's philosophy, and that's something that it's okay to ask them to their face when you first meet them. It's important for patients to understand their doctor's philosophies and see if it's in line with theirs. Is it something that they're looking for to improve their care?
Because it's really a long-term relationship, and you're talking about your health, which can be very personal. And you want to make sure you have that open line of communication. For sure. Is it good for you? Now, I know that there's family medicine, so they see the whole family. Is it good sometimes for the whole family to have the same doctor? Is it good for a husband and wife to have the same doctor?
That depends. It's really up to the patient and what they want.
What are the benefits of having the whole family see the same doctor?
Personally, as a physician, I think that it is nice to see multiple members of the same family. It does help build a stronger relationship, and it really helps me know where my patients are coming from. But needless to say, some patients have a different philosophy from their doctors, or this doctor their spouse is seeing, or their spouse is seeing a female provider and they prefer a male provider. And that's totally okay. And I think in general, it's really up to the patient and what they feel comfortable with.
Because that's it. The comfort level is really key, because if you're going to have that open, honest relationship, you have to have that comfort level. Should you change to a geriatric physician when you turn 50, 60, 70?
In general, I would say no. If you've been with the same doctor for years and they know your history and you like your doctor, I think that having someone who knows your history best is going to actually improve your care. And it's by switching to different doctors as you get older who don't know your extensive medical history as well because they've just met you, you might not get as good care. You can switch to a geriatric doctor. In some cases, you may have chronic conditions that are associated with age. And in
such as
dementia and things like that. And in those certain circumstances, it's a discussion that you should have with your current primary care provider. And together you can come to the decision of if a geriatrician is basically of more benefit in this situation.
So we talked about this a couple of minutes ago, and let's come back to it now. What advice do you give new patients when they're establishing care with a primary care doctor? What kind of a medical history should they bring to that first office visit?
Sure. I think having your medication list is probably the most important thing. Either you can bring in your pill bottles or have an actual list of your medications and dosages, because then your doctor can understand which meds you're taking, know which meds they should or should not prescribe in case there's interactions, and also having your immunization history so that your doctor can make sure that you are up to date with all your immunizations and routine preventative screening in general.
And health screenings from the past several years?
Yes, definitely.
How far back do you want them to go?
I would say if it's things like colonoscopies, you probably haven't had so many of them in your life, so you should probably know which ones you've had. And then in terms of mammograms, pap smears, probably the last year or two would be fine.
And what about abnormal test results or surgeries or medical procedures that you've undergone?
Major ones you should definitely bring into your doctor, because it does play a part in how your doctor is going to care for you.
And you talked about current medications, but what about supplements? Because I know a lot of people do take supplements nowadays.
Yeah, definitely. With supplements, it's a little bit harder because they're not all regulated. They're not all the same across the board. So somebody might be taking a B12 supplement. Somebody else might be taking a B12 supplements, but the ingredients are actually different and the way they're made are different. So if you are taking supplements, oftentimes it's actually good to bring your bottles in so that we can see the back of the bottle, see exactly what's in there.
Or you use your cell phone and take pictures of them.
That too. So you don't have to carry a whole bag of it.
Both the back and the front. Mm-hmm. Now, if you're relatively healthy, you might not think that you should go see a doctor on a regular basis. How regular should you be? How important is it to see a doctor once a year, twice a year?
When you're younger and healthy, it's probably not as urgent for you to see your doctor on a yearly basis or every 6 months even, but I do encourage it, because really that's the time that you get with your doctor to establish that relationship, and so they can know what's going on in your life, so they can understand you as a whole person rather than just your medical complaints, so that when you come in, you're not just, I have a cold kind of situation. It's just seeing the whole picture and taking care of you as a whole person.
And the comfort level, we keep going back to that because it is so key. Let's say, you're interviewing a doctor for the first time and you just don't quite feel comfortable. Mm-hmm. Should you go ahead and see them anyway, or should you shop around?
It's okay to shop around for doctors, because the bottom line is really we want you to feel comfortable with who you're seeing. It's important for your healthcare to be able to talk to your doctor openly and honestly. And if you feel like you can't do that, then you're really holding yourself back from appropriate healthcare. So we usually recommend, if you don't like your doctor, it's okay to switch to somebody else and someone who you feel comfortable talking with. And
let me go back to one other thing. When you're looking for a primary care doctor, is it better to look for somebody who's out there on their own? Is it better to be, within a whole group of doctors? So if for some reason, you need to see a doctor right away and your doctor's not available, then there's other folks within the group that you should see?
Mm-hmm. I would say it's also up to the patient preference and if that's something that they're concerned about. I generally recommend seeing someone who is in a practice, because if your doctor falls ill or say they're out of town, you might see one of their colleagues. And if they're in a bigger practice, there are more people who are able to continue that care. And specialty services is really important too, which Scripps offers a lot of. We have a lot of different specialty services. Patients who need these specialties are able to get to them a lot easier, and they're all within one network. So say I refer you to an orthopedic doctor, they will see you and then write their note, and I'll be able to see your note. So it does make it a lot easier, and it just gives us a more comprehensive picture and allows us to continue your continuity of care, essentially.
Just elaborate a little more on what a specialty service is.
Sure. So it's kind of different from the primary care physician, who is your general practitioner who you see whenever you fall ill on a regular basis. Say you have a chronic condition, say you've had a heart attack, then it's important for you to see a specialist like a cardiologist who has specialized in the heart. They have spent extra years studying the heart and they are able to manage you for that certain condition.
So a specialty doctor would be an orthopedic doctor for your, hips, knees, your bones,
Exactly.
spine.
And you might not need to see them, but if you do, it's helpful to have someone in network to do so.
So especially would be somebody who specializes in diabetes, or a neurologist for your head, or
Yes.
somebody for your lungs. But the primary care, once again, to go back, is the quarterback.
Yes.
Okay. Any final thoughts, doctor?
Just honestly pick someone who you can talk to, who you feel comfortable with, who you like. At the end of the day, it's going to be one of your most important professional relationships that you'll maintain over the years. So we want you to like us and feel comfortable with us.
Great. Thank you so much. We really appreciate it. If you're looking for a primary care doctor, if you're looking for any doctors really for that matter, you can go onto the website, just go to scripps.org, and then you look under the sign which says Find a Doctor. If you want more information about primary care physicians, you can click on our link. You can also go to scripps.org/videos. If you want more critical information about your health, we take care of you from head to toe. Please subscribe to our Scripps Health YouTube channel and follow us on social media @Scripps Health. I'm Susan Taylor. Thanks so much for joining us. It's our mission at Scripps to help you heal, enhance, even save your life.